Hi, my name is Faris Mujezinovic. I'm professor and specialist in obstetrics and gynecology, and in this video I would like to explain why ROTEM diagnostic test is so useful in regular obstetrical practice. Any birth can be accompanied by unexpected postpartum hemorrhage that is so severe that it can seriously endanger mother's life. As soon as bleeding occurs, we need to act quickly and decisively, otherwise the condition worsens and the procedures that we perform are not as effective as they were in the initial stages of bleeding. Every delayed minute and extra liter of blood loss further intensifies postpartum hemorrhage to the point that it becomes almost unstoppable over time. The more severe the bleeding and the blood loss, the faster the remaining blood in the mother's body loses its ability to clot. This, however, is a basic condition for medications and surgical interventions against postpartum hemorrhage to have any success at all. Not until recently we didn't have a reliable assessment of blood clotting ability during postpartum hemorrhage because the standard test such as coagulogram wasn't sensitive enough or fast enough to detect these differences, much less to show us which clotting factors are most effective and give us directions to make corrections. Even with large blood losses, hemostasis tests such as prothrombin time and activated partial thromboplastin time remain within the normal ranges and give a false impression that blood clotting ability is functioning normally. Therefore, the earlier predictions of blood clotting disorders were based primarily on general and unreliable clinical impressions, and corrections with blood products were made mainly by feeling, clinical experience, or general guidelines without any feedback what is actually happening in the mother's blood. However, this is not exactly the ideal choice, because the blood products and other medications against postpartum hemorrhage, in addition to their benefits, can carry some serious negative effects such as allergies, thrombosis, or transmission of infections. Therefore, in clinical practice, we need such a diagnostic test that it's reliable, accurate, and fast enough to detect blood clotting disorders during the postpartum hemorrhage. This would help us answer two very important questions. The first question is there any blood clotting disorders developing during postpartum hemorrhage now or in the future? And which clotting factors specifically are most affected? And the second question is which practices and interventions are mostly needed? And even more, which interventions or practices are not needed in these particular patients with postpartum hemorrhage? All these questions can be reliably answered by ROTEM diagnostic tests. Even further, the ROTEM diagnostic test can show us if our interventions are effective enough and what will be the future step in corrections of blood clotting disorders. What exactly is a ROTEM diagnostic test? We will explain in the next video.